Indiana Newsdesk is made possible in part by Smithville Fiber Internet, streaming TV, home security and automation in Southern Indiana. More information at smithville.com. Mallard Grodner Attorneys, providing legal services to clients and the community. Understanding, expertise, results. Bloomington and Indianapolis. lawmg.com. IU Alumni Association, connecting IU's network of alumni and sharing the Indiana spirit through scholarships, advocacy, and volunteerism. alumni.iu.edu. IU Center for Rural Engagement, extending IU Bloomington resources to improve Hoosier lives in partnership with communities and organizations. rural.indiana.edu. And by WTIU members. Thank you.
Coming up on Indiana Newsdesk. Hoosiers will have to keep wearing masks in public for at least another month, and the governor says those who are frustrated need to realize the reality is we're in a global pandemic.
Is it spreading at work? Is it spreading at home? Is it spreading when we let our guard down?
The latest Indiana COVID-19 statistics coming up. Monroe County education leaders say they have a plan for bringing students back to school safely.
If there is any district that can open safely, MCCSC can do that.
Ahead, details of the reentry plan and the metrics the district will use to decide if school closures are necessary. Hoosiers are putting off going to the doctor because of the virus.
People are presenting, unfortunately, with later stage diseases because they've been putting off that care.
Coming up, the potential impact it'll have on their long-term health. Those stories and the latest news headlines from across the state right now on Indiana Newsdesk. Welcome to Indiana Newsdesk. I'm Joe Wren. Well, some of Indiana's COVID-19 metrics, like the rate at which tests come back positive, are trending down. The governor says while that's encouraging, Hoosiers still need to be vigilant.
We don't want that to trend up. We'd like to see it start to trend down even more so.
Indiana has more than 90,000 confirmed COVID-19 cases and nearly 3,100 deaths. The state's 7-day positivity rate of newly reported cases is at 6.5%. The governor says Indiana will stay in its current phase, stage 4.5, for at least another month. That means, for instance, restaurants can only be at 75% capacity, while bars, nightclubs, and tourism sites are at 50%. The governor is also extending his statewide order to wear masks in public for another month. Healthcare experts say a troubling trend is developing amid the coronavirus pandemic, and it involves something as simple as a checkup. Practitioners say fewer folks are seeking routine preventative care, and it's already having a significant impact on the health of Hoosiers. Brock Turner has more.
For Indianapolis mother Damaris Contreras, the decision to take her daughter to the emergency room after a fall during cross-country practice earlier this month was beyond difficult. Her daughter Sierra is in 6th grade and came home complaining of pain and a tingling after falling during a run.
She said it felt like it burned from her toes to her knees, and so it was just something that I just could not ignore. But I knew that it was more than ice and Tylenol.
Contreras reached out to friends who were doctors and nurses in hopes of avoiding a trip to the emergency room. Each recommended she take Sierra to go get checked out. But Contreras, who had put off non-essential appointments and preventative care visits for herself and her family, was hesitant. This trip, though, was unavoidable.
It makes me nervous, and I don't like it, but we do it only when we have to. And an absolute have to.
She wasn't worried about the hospital staff or doctors. She just didn't trust the folks sitting in the waiting room with her.
But then the waiting room filled up with people that were not so much aware or as cautious as I would have liked for them to have been. And so I felt a little uncomfortable even then just sitting in the waiting room because I didn't know where these people were from and what kind of precautions and what they were walking in with.
And Contreras is not alone. Estimates show significantly fewer Hoosiers are seeking preventative care visits and undergoing elective procedures amid the coronavirus pandemic. That's leading practitioners to sound alarms. Data shows Indiana hospitals have seen emergency rooms and elective procedures plummet. While patient levels have returned to near normal levels in Indianapolis-based Community Health Network, there is a significant portion of the population that remains hesitant. That's according to the president of Community's Physician Network, Dr. John Kussner.
But we do know from our consumer research, there's about 20% of folks that just say they're not ready to come back this year and that they're pushing off elective things to next year because they want to wait and see.
For Dr. Camuel Wright, the medical director for CareSource Indiana, these trends are most concerning in two populations.
One is people of color, particularly African Americans. We already have a lower rate of seeking preventative health care, and we also have a higher rate of susceptibility to chronic diseases. In COVID times, this is magnified. So we are seeing less individuals from communities of color seeking important health care.
That's something Tracy Lewis has seen firsthand.
It's not that people don't know they need to go to the doctor. You'd be surprised how many people at a health fair, or a church, or wherever will mention some of their symptoms to somebody like me. And so it's not that there isn't the concern or desire, but often people will mention that they have a deductible or that they don't have health coverage, that they don't have a doctor who they have a good relationship with. Historically, a challenge has been the issues around trust.
Also at a higher risk are folks living in rural communities. Wright and others say a lack of broadband internet, longer trips to simply get to a doctor's office, and the age of populations there place them at higher risk for disease before the coronavirus. But COVID-19 only heightens the problem.
Individuals in these communities are also less likely to seek preventative health care. So I think that we as an organization and we as a community need to think through how we bust through barriers and make sure that individuals in these communities get the necessary health care.
For both groups, the issues are systemic and difficult to solve.
So these are not new issues. These are known issues to my organizations and other people in the public health space. It's just that these issues have been magnified by coronavirus.
Practitioners are worried about the long-term effects of this hesitancy.
And our docs are already seeing this. So if you ask our emergency room physicians, our cardiologists, our surgeons, our oncologists, people are presenting, unfortunately, with later stage diseases because they've been putting off that care. So we're already seeing it today.
Despite those warnings, folks like Contreras say they're going to hold off on making appointments that aren't completely necessary for now. She doesn't plan to have them until there is a vaccine or proven therapy. For Contreras, the worry is not even for herself. Like most mothers, she's more concerned about the health of her two children.
Maybe I should, but I don't, because moms tend to think of themselves last, and I guess that's where I am.
For Indiana Newsdesk, I'm Brock Turner.
8 of Indiana University's 68 fraternities and sororities are under a quarantine order following what IU Public Safety called an alarming increase in COVID-19 cases caused by community spread. IU and the Monroe County Health Department on Thursday directed all house student organizations to suspend any in-person activities through September 14th. IU spokesperson Chuck Carney says IU detected the increase in cases through its mitigation testing program and is working with the Greek houses to make sure the quarantine order is followed.
We will be checking in with them every day and frequently with our health professionals to make sure that they are adhering to what they need to do.
Now, students who do not comply with local and university COVID restrictions could face suspension. Monroe County Community School Corporation is sending students back to in-person learning. The school board approved a new reentry plan this week that will open up the schools on September 8th under a hybrid learning format. The district will then look at the positive rate of COVID-19 cases in the county and decide whether to send kids to school all 5 days of the week on September 21st. Now, families who wish to keep their kids online will be able to do so, but not in the proposed online academy. Those students will still have the same teachers as their classmates. Our Ethan Burks has more on the story.
After several weeks of discussion and debate amongst local health and educational professionals, MCCSC plans to open its doors to students again, but under strict safety guidelines. Superintendent Judy DeMuth says students will be asked to wear face masks at all times, and desks will be placed 6 feet apart in all the classrooms.
There's one thing we know about kids. I've been in education for a long time. They rise to the occasion, and I don't think this will be any different. So we anticipate really a good success rate on the whole mask and distancing requirement.
When the school board met in late July to decide on resuming in-person instruction, they encountered pushback from parents and teachers who thought the plan didn't clearly define how the district would decide when to close schools. Since then, the district formed a committee to come up with specific COVID-19 metrics. The committee is made up of local health and education officials, as well as a handful of parents and teachers.
At this point, there is no specific algorithm or formula that can spit out a magic number to say whether it's safe to go to school or not.
But Mobley says with the help of the Monroe County Health Department and IU Health, they were able to come up with a way to look at the whole picture. Each week, the metric committee will decide if the district is in the green, yellow, or red phase. Green means students are safe to go into schools. Yellow will be a hybrid method that alternates between in-person and online school days throughout the week. And red is all students go back to online learning because conditions are unsafe. The district will then look at the 7-day rolling average of positive cases in Monroe County to determine what phase the district is in. If that number is less than 5%, MCCSC is in the green phase. 6 to 9% is the yellow phase, and if the positivity rate exceeds 10%, it's the red phase. Parents who are on the metric committee say they understand it might be difficult for families to send their kids to school based on a number.
I know that this is a metric, it's on a sheet of paper, it has some numbers to it, but also I want you to know that this is very human, it's very emotional, and people would love answers and communication.
The district says the numbers are just an overall guideline, and a decision to move students back to online can be made any time to ensure everyone is safe as the pandemic continues. For Indiana Newsdesk, I'm Ethan Burks.
Riley physician's pediatrician Dr. James Laughlin is one of the members of the Metrics Committee. He joins us now to talk more about the Monroe County's new parameters for in-person versus online learning. Doctor, thank you very much for being here. Let's just get with, the Metric Committee is using that positive test rate as the primary metric for determining when it's safe to be physically in schools. Can you explain what that metric means and how was that chosen?
It was chosen by a committee that was a multidisciplinary committee composed of physicians, community members and parents, epidemiologists from the university, and other professionals. And what we looked at is what are the general metrics that are being tracked by the CDC and the State Board of Health. And we chose 3 metrics that we felt were pretty objective, but would be able to tell us trending that was occurring rather virtually. And so we picked the 7-day rolling % positivity rate, along with absolute number of cases on a 7-day rolling average, and also looking at daily cases per 100,000 population. Additional metrics that we chose also were 2 metrics that looked at ongoing turnaround test time to make sure that we were able to obtain testing results in a timely fashion to quarantine or isolate people, and also do immediate contact tracing within the schools. And the school system is basically spearheading that project to be able to implement that immediately.
So how does the MCCSC's plan differ from the guidance that just came from the state this week?
Essentially, it's not too different. These are just guidelines that we're going to use along with other parameters, such as guidelines from the state and the CDC as well.
Dr. Scott Moore, who's on the Metric Committee, says it's safe. It's time to bring kids back. Do you feel the same?
Exactly. I think the emotional and psychological healthcare benefits far outweigh the risk at this point, and we would challenge that if these guidelines are followed, and also parents and adults take responsible action in the community, that the school is probably the safest place for these kids to be.
All right, Doctor, thank you very much. Of course, something that we'll be keeping tabs on. Appreciate your time.
Thank you.
Mediation help is now available to Hoosier landlords and their tenants at risk of eviction, free of charge from the Indiana government. Both the landlord and renter must agree to the mediation, and the goal is to keep eviction cases out of the courts whenever possible. Potential settlement outcomes can include payment plans and back payments, but they also can involve eviction. Estimates show as many as 720,000 Hoosiers could be at risk for eviction. While the NAACP is helping Hoosiers who can't pay their utility bills. According to a study by Indiana University, a lot of the people who have lost jobs during the pandemic are the same ones who had trouble paying their bills before the crisis. Low income, elderly, African American, and Latino residents. At the same time, people are spending more time at home and it's hot outside, which is driving those energy bills up even further. The NAACP says many people are having to make tough choices between paying for housing, food, and energy.
They may seek out, things like payday loans, right, or other sort of risky loans or high interest loans to get through in the short term.
As of last week, utilities are allowed to resume disconnections for unpaid bills. Carly says one way the state and federal government can help would be to consider or reconsider ways to protect people from shutoffs.
Another is to think about the debt that they accumulate during the time that they are protected and finding ways to help relieve some of that debt or forgive that debt after the fact.
To receive utility assistance through the NAACP, you must be African American or of African descent, referred by a local NAACP branch, and show that you faced hardship due to the COVID-19 crisis. Coming up next on Indiana Newsdesk. More executions took place this week at the federal penitentiary in Terre Haute. Reporter Adam Pinsker was selected as a media witness. Ahead, he joins us from Terre Haute. The Indy 500 was run last weekend without fans. Now, businesses that depend on the race to keep them afloat are calculating their losses. These stories and more right here on Indiana Newsdesk.
The WTIU WFIU news team connects Indiana to the world. We bring you the top news of the day on radio, TV, and online. We round up the stories that have people talking each week and dig deep into the issues that affect your community the most. The WTIU WFIU news team is where you are and telling your story.
In a time of change, where can you find in-depth reporting and thoughtful analysis? Washington Week on PBS. Join moderator Robert Costa.
When I was at the Capitol this week, I encountered the same.
And a panel of award-winning journalists.
You're seeing a divided nation and you're seeing.
For insights and perspective.
Tonight there was a key development in the
Senate. You won't find anywhere else.
What a week.
Washington Week.
Welcome back to Indiana Newsdesk. Well, despite pleas for clemency by the Navajo Nation tribal government, President Trump did not intervene in the execution of the only Native American on federal death row. Adam Pinsker was a witness to Lesmond Mitchell's execution.
No, I'm good. Those were Lesmond Mitchell's final words right before he was executed at the federal penitentiary in Terre Haute on Wednesday evening. He was convicted of murdering a 63-year-old grandmother and her granddaughter at a Navajo Indian reservation back in 2001. It took 26 minutes from the time Lesmond Mitchell's lethal injection began until he was pronounced dead by a Bureau of Prisons official. Daniel Lee, the father of one of Mitchell's victims, said through his attorney he waited 19 years to get the justice he was seeking.
I will never get Tiffany back, but I hope this will bring some closure.
Mitchell's execution divided members of the Navajo Nation, a 27,000 square mile sovereign reservation on the Arizona-New Mexico border.
The federal government should not be executing Navajo citizens without the nation opting in.
Council Delegate Carl Slater says the federal government violated a 1994 law called the Federal Death Penalty Act. It bars the federal government from executing a member of a native tribe if that tribe decides to opt out, which is exactly what the Navajo Nation Public Safety Committee decided almost 20 years ago when the crime occurred.
They delivered a pretty substantial report, and in the report they said that they recommend the nation does not opt into the federal death penalty, and to date the nation never has opted in.
Members of the group Death Penalty Action has protested every federal execution since they resumed last month. Director Abe Bonowitz believes it's no coincidence the Trump administration scheduled Mitchell's execution and the execution of a second man, Keith Nelson, on the same week of the Republican National Convention.
I think the evidence is going to show it's all about creating this distinction between the president and his challenger, and then turning around and being able to challenge the Democrat and say, why wouldn't you have killed these people?
Bonowitz points to this letter on President Trump's re-election website, posted shortly after the July 14th execution of Daniel Lee, criticizing his opponent, Democrat Joe Biden, for opposing the death penalty. New York Congressman Adriano Espaillat is drafting a bill to ban the federal death penalty. So far, he says 55 lawmakers are backing the legislation.
We know that Trump will probably not sign this into law. I believe it is important that we lay out the work, the groundwork.
But Lee, seen wearing a Trump 2020 hat, said through his attorney that if it wasn't for the president, he may never be able to have closure in this case.
I would also like to thank Attorney General William Barr and President Donald Trump for their pursuit of justice for Tiffany.
In September, there are 2 more executions scheduled for the federal penitentiary here in Terre Haute, including William LaCroix and Christopher Villalba. Villalba would be the first African-American person put to death here since federal executions resumed in July. For Indiana Newsdesk, I'm Adam Pinsker.
Despite the COVID-19 pandemic, Indiana's Secretary of State insists this fall's election will be normal. Many Hoosiers, even via lawsuit, have pushed the state to allow anyone to vote by mail for the general election, as Indiana did for its primary. But Republicans, including Secretary of State Connie Lawson, have rejected those pleas. There are about a dozen reasons you can legally cast a mail-in ballot, including if you're confined to your home by illness. Lawson said fears over COVID-19 for those in high-risk populations might fall under that provision. Indiana is one of just 6 states that refuses to expand vote by mail this fall. When the Indianapolis 500 ran without spectators last weekend, it wasn't just the hundreds of thousands of fans who were missing. It was also the millions of dollars they pump into local shops and restaurants. As Indiana Public Broadcasting Samantha Horton reports, businesses in the racing capital of the world expect to take a big financial hit this year.
Japanese IndyCar driver Takuma Sato took the checkered flag to win the 104th running of the Indy 500. But instead of the roar of crowds to celebrate the moment, it was just the humming of engines. This year's race was postponed from May to August in response to COVID-19. Track owner Roger Penske was determined to still have fans, reducing capacity and then creating a comprehensive health plan. But Indianapolis Motor Speedway president Doug Bowles says ultimately the efforts were just not enough.
And the best thing for us to do as community partners was to just go ahead and have the race without fans.
And the economic impact of not having spectators ripples outside of the track. A study commissioned in 2000 by IMS showed the Indy 500 brings about twice as much revenue into the local economy as the Super Bowl. Standing outside IMS, race fan Ed Wank hears the cars zip by on the track during a practice session. Wank decided early on that his family would not go to the race, but says one of his favorite things about the Indy 500 is his family's race day tradition. Every year they bike to the race and eat at the same restaurant afterwards.
It's turned into this ritualized event where it's just not the same if we don't do A, B, C, and D. And there's a ton of other families with a ton of other stories that are similar to that, whether they live in Speedway or if they live in Michigan.
Those traditions put dollars into local businesses in and around the track. Main Street in Speedway is one popular location fans flock to during the month of May. Restaurants have outdoor seating where customers can sit and hear the IndyCar drivers on the track.
Everyone thinks of, when they think of May, they think of the race. It's basically fasten your seatbelt and you go for a ride the whole month, and then the pinnacle is the Indy 500.
That's Dawson's on Main co-owner Chris Hill. May is usually a month of events that keep things busy at his restaurant. Hill says the pandemic hurt his business, but he isn't sure just how much yet. Speedway town manager Carlos May says it's not clear how much of an economic hit the town will take without the revenue from race fans. However, May says local nonprofits have already reported expected losses from race weekend.
So they do get a huge amount of money from that, to the tune of $272,000, plus or minus a couple thousand. So it has certainly been an impact to their bottom dollar.
Just steps away from the track, the American Legion Post 500 commander Johnette Lawson says it's usually packed the entire month leading into race weekend.
Normally this place would be 110 campers here.
going into the track. And then plus we park a lot of cars. I'd say about 75 cars we can get in here on race day.
This time the lot is practically empty with only a few campers parked in the grass. Lawson says not having fans at this year's Indy 500 is a major financial hit.
We lost about 75% of our profit. And so because this is the month, May is our month that gets us through the entire year. And it helps with all the charities that we donate to, just anything for the community and our veterans and our soldiers and their families.
While the out-of-town crowd wasn't there this year, Chris Hill says the local residents have stepped up to help the mom and pop businesses.
We've been here for 14, almost 15 years. And, we're a fabric of this community, just like everyone else on Main Street and around Speedway. So I think we're all hurting, but the community rallies behind us and it makes it not sting as bad.
The parking lots and bleachers may have been empty this year, but people in Speedway are already looking to next May in hopes of having Indy 500 race fans back in town. For Indiana Newsdesk, I'm Samantha Horton.
That's the end of this program, but our work continues online as we cover the news throughout the week at WTIUnews.org. Have a great weekend.
Indiana Newsdesk is made possible in part by Smithville Fiber Internet, streaming TV, home security and automation in Southern Indiana. More information at smithville.com. Maller Grodner Attorneys, providing legal services to clients and the community. Understanding, expertise, results. Bloomington and Indianapolis. LawMG.com. IU Alumni Association, connecting IU's network of alumni and sharing the Indiana spirit through scholarships, advocacy, and volunteerism. Alumni.iu.edu. IU Center for Rural Engagement, extending IU Bloomington resources to improve Hoosier lives in partnership with communities and organizations. Rural.indiana.edu. And by WTIU members. Thank you.